Hello, I'm Karen Harrington, and I'm the director at Catawba County Social Services, answering a few questions about COVID-19. The first one is, how did COVID-19 impact our agency? In many ways, but certainly at the onset of COVID-19, we scrambled to evaluate our continuity of operations and to ensure that our staff and those that we serve were as safe as possible. That included making sure staff had PPE, making sure that the lobbies had plenty of space for social distancing. We also worked very closely with the state to ensure that as many of the programs that we administer had access to an online application type process, to limit people having to come face to face into the building. And that's actually gone very, very well. That's helped decrease our foot traffic and some of that requirement for face-to-face interaction. And that's kind of, I guess, the downside is that it's decreased our face-to-face interactions with many of the people that we serve, certainly in our mandated areas like child protection and adult protection. That hasn't changed. We're still making those appointments and seeing people face-to-face, but that's probably the first impact that COVID-19 had was around those types of things. Number two is, how's the pandemic affected our employees, our clients, and those we serve? And yes, so aside from the fear and the uncertainty, all of the unknown of COVID-19, I think originally, and even maybe somewhat even now, that has continued to be an impact. Just the great unknown. Am I going to get it? Is someone I love going to get it? Should clients come back into the building, and should we open up our doors fully and have face-to-face interviews and interactions? Aside from that, the impact of the pandemic has been minimal on staffing. We haven't had a tremendous high number of employees get sick. We're very grateful. We've prayed very hard for that. But we certainly see the impact of COVID-19 on those we serve in regard to their income and their housing stability, and certainly their access to food. If you lose your job and your hours have been cut, those essentials like food are hard to come by. And so we have certainly seen, the business closures and the impact of loss of jobs and income on those we serve in a great way. That's been really hard to watch happen. And then the third question is, what are you seeing develop within your community, within my agency, and how can EACHICM help? Well, EACHICM's footprint is a wonderful one here in Catawba County. We've actually partnered with them on some federal COVID funding that our agency received and that now they're administering in the community. And that's what I'm seeing. I'm seeing the provider community really, really come together and pool resources, both fiscal resources as well as human resources. One agency that was closed for a couple of weeks when the pandemic first started sent their employees to other nonprofit agencies to help support and volunteer in those agencies so that staff could continue to get paid. And just this real emergence and assessment of need in the community has been just amazing to watch. I guess you don't really realize the strength of your community until it's really tested in a way like this. And thankfully, our community hasn't been tested like this very often. I think in the late 2008, 2009, and the economic depression that occurred then with the loss of jobs in our area, that was a test to our community. But in more recent years, this is probably the biggest thing, certainly in my lifetime, that I can really think of that's impacted as deeply as this has. But again, to see the provider community just rally around those in most need and sharing of resources has just been so encouraging and just instilled that hope that I think everyone really needed for such a time as this. So thank you.